Health authorities in Western Australia are saying schools may have to be closed in winter as COVID-19 spreads, with WA recording its 6th case of the virus. Joining us live here in the Perth studio is the President of the WA Australian Medical Association, Andrew Miller. Appreciate your time. Thank you for joining us. When we're talking about shutdowns of schools, are we talking about a scenario where there are mass closures for weeks, or do you think it's more likely to be an ad hoc situation where a virus is detected in a student and then that particular school responds?
Well, in Australia we seem to be still trying to believe that this might not be coming, and so we're doing things on a bit of an ad hoc basis. We're a few weeks behind where we need to be, so we're certainly thinking in the AMA that if we're like Italy, and we've got no reason to believe that we're not. It's not a racist virus. It behaves in a fairly predictable way. We're a few weeks behind in numbers. So what we should be looking at is some big steps now to slow the spread of this so that when it arrives, we can deal with it within the health system. So mass school closures will be required, and they will be required soon. We also need to get telehealth so that doctors can do all of their work, not just COVID-related work, not just for GPs, all of their work that possibly can be done remotely. We should move to that very soon. We need both branches of government to get together, sort that out. We don't want another bushfire situation where the feds and the states are pointing at each other and saying, well, that was their responsibility. Act and act now. Look at Italy. We are just the same as they are.
So when you're saying act and act now and talking about schools, would your advice, the AMA's advice to the government, to be shutting down schools from tomorrow?
They should seriously consider in the next few weeks whether it's safe, with community transmission, is it safe to allow those numbers of cases to come online? We know that it's out there in the community. In Western Australia, we haven't even been testing patients unless they've travelled to high or medium risk countries. We have no idea. Blind Freddie can tell you that people have been travelling to the United States and many other places have brought cases into our community now. We've got people in Perth who've been trying to get tested. They believe they have the disease. They've been advocating for their own test. Can't get it. We're not ready yet. We've got 3 small COVID clinics opening today. They should have been open a couple of weeks ago at least.
Okay, so the message that you're giving us right now is very different to the one that we've been hearing from governments at state and federal level.
Yes.
They're telling us keep calm, carry on, go about your normal business. Is that the wrong advice?
Well, you can't go about your normal business. This isn't business as usual. You have to start making some plans. And if the people in Italy had not made plans a few weeks ago for what will happen when the schools close, that's the sort of thing that creates panic and chaos, is when suddenly you realise what the world's not what I thought it was. We need to be preparing the population. Now, that doesn't mean we panic them, but I think the population are pretty savvy. They see what's going on around the world. That's why they've been buying a few supplies. Everyone's joking about toilet paper, but I could get told today that I need to stay at home for the next 2 weeks from my job and in order to be quarantined, and also my kids might need to be home from school for a prolonged period of time. It's not a possibility that the schools in Australia are going to close this winter. It's a definite. That's what's going to happen if we're going to have a chance of slowing down and stopping this virus. It's showing no signs that it's going to behave any differently in Australia to what it did in Italy. And if you have a look back on the numbers, we're only a few weeks behind where they are. Tick, tick, tick. It's time to fix it now, government.
So the panic is justified?
No, panic's not justified. We don't tell anyone to panic, all right? So you don't run around and panic. I don't think anyone's panicking. People are stocking up. They're buying a few weeks of supplies because they're seeing that people are getting told, well, you've just had a test. I didn't expect to have the virus, said that doctor in Melbourne. I just did the test as a precautionary. He didn't meet the criteria to be quarantined or to have a test, and yet he was positive. How many more of those are there who've travelled to Indonesia or to the United States or to Canada who are now in our community? And the way this thing spreads, it goes to 3 or 4 people from each patient, and so that's the way it goes rapidly. The great thing about closing schools, although obviously it's massively disruptive, the great thing about it is this virus spreads very well through children because they don't feel that unwell. And children are disgusting. They cough on each other all the time and share their food and so on. That's how it's getting through communities quickly.
So to parents listening to you today thinking, well, should I be sending my kid to school tomorrow? Should I be taking action and get ahead of this? I mean, do you have kids at school? Are you keeping them home?
I have university-age kids. They have the advantage of being able to, of course, be young adults now, make their own decisions, but they can do lectures remotely. What we want to do is slow how this virus spreads through the community. So large gatherings are going to be a real problem. The fact that the Grand Prix is still scheduled to go ahead in Victoria, madness. We can't afford that at this stage of an epidemic that's breaking out. So I understand that there are enormous economic repercussions, but there are worse economic repercussions if you don't prevent the contagion as it arrives into your community.
And what would your advice be to elderly people, to people who already have respiratory problems? Should they be essentially self-isolating and avoiding mass gatherings?
Well, yes, they should. If you're in the age group, I don't think it's a panic thing. I think it's a precautionary thing. And you want to delay the time for as long as possible so that possibly there will even be a drug that works. And in 12 to 18 months, we'll even have a vaccine. And if you can avoid it for that long, then that will be a good thing to do. So we'll see the shutdown, the lockdown of nursing homes so that there's not visitors coming through and exposing that population to this. And it's going to be happening very soon. If it's going to be happening in a few weeks' time, let's just talk about it now, be honest about it now. Let's not say it's business as usual because we don't want people panicking. I'll tell you what will make them panic is when they realise the government's been reassuring them and everything's not okay.
I'm just getting some breaking news in. A major Sydney hospital is being forced to move some surgeries to its private partner as it prepares for an expected influx of coronavirus-affected patients. We're seeing, as you mentioned here in WA, these clinics opening today offering testing. Apparently there have been lines since first thing this morning as people turn up to want to be tested. Is any of this surprising you?
Well, not at all. It should have been done weeks ago. This is the problem, is that people are a little bit like maybe it's going to be different here to Italy. At some stage it's not going to be any different because the virus will behave very similarly. Perhaps something will change about it as time goes by, but we see no evidence of that yet. So all of these stories of it's in a school now, so that school has to close. It's in this school now, so that school. It's out there in the community already. It doesn't mean we need to panic. We can deal with it. 80% of people are going to have this as a mild cold. Some people won't even know they've had it. And that's how it spreads around the community very easily. So it's not going to be a drama. And if we can drip feed the cases into the hospitals rather than have a huge outbreak all at once so that the hospital becomes overwhelmed, that's what happened in Wuhan. They just could not treat a lot of people because all the cases arrived at once.
And should people with non-urgent medical problems, should they be avoiding GP clinics at this point?
I think that a lot of the GP clinics will be saying we're not equipped to handle this. The GPs have not been given by the government the personal protective equipment they need. If you go down to one of the COVID clinics, you will see them wearing proper gear. And the government have been expecting that GPs, who see a lot more patients, by the way, than the public hospitals do. Busy GP practice sees a lot more patients in a day than an emergency department. And they have no gear. So that's like sending your army up the beach with no guns and saying to them, could you go and see if there are any Turks in the sand dunes up there for us? We're holding the guns for when the big battle starts. And the GPs are like, well, what are you talking about? We need the gear now. We need the facility set up now. We're not equipped for this. And the governments are, well, OK, we'll open a clinic here and a clinic there and it'll be online. That's the way bureaucracy works and it's not quick enough in this situation.
Andrew Miller, the WA President of the Australian Medical Association, appreciate your warnings and advice there. Thank you for that. A few good points there that would be worth putting to the Health Minister, I think.
We don't need to panic. We just need to get ahead of it. Let's get a few weeks ahead.